pretty big. Here's a sample implant. This is a Mentor 450. This is what they call an HPX. So it's a high profile. You see that curve there. It's flat on the
That looks
bottom.
nice.
So they have different styles. So some are the low profile where I'm going to squish this down like flat, and then there's like a medium, and then there's the high. And what that has to do, the way I tend to handle this, let me see if this one is a different profile. I can see, yeah, this one here you can see is a little bit lower. Let me put them side, kind of see the difference. And this is a lower profile one. I think this is a medium, and this is a higher profile one. There's a couple different ways to choose how you're going to put in an implant for somebody, and it depends, I guess, on whether if you have one in already, how big your breast is, how thick the tissue is, a lot of different criteria. These books behind me here, I think I'm watching all these people on TV, I guess you look smarter if you put books in the background. You're putting a few books back there. One of those by a guy, he's no longer alive, but he was a world-renowned breast surgeon. It was about, reconstructive and cosmetic breast surgery. But it's all basically similar types of things. So if you study these techniques, the size that you put in depends kind of like on what your body style is. You can't just put anything into anyone.
Exactly.
You can't. Your risk of problems happening starts going way up. So that's the key. So, I don't use one of those computer imaging. Like sometimes they have these things where they take a picture and then they program it in what it's going to be a certain size. I've never needed any of that. I've actually been to places where they have them, and I haven't been that impressed. What the results are is that, and if you look at any secondary breast case from our own, it's really low. I mean, it's way lower than the published literature because I follow techniques that we've learned over the years and working with a lot of different surgeons and things. So it's I base it mainly on the quality of the tissue, the size of the breast base, and what you're looking for. Because if people want to be, if people want as big as they can go and they don't care if it looks real or not, then you start talking, what's the biggest size we can get away with?
Right.
Then, hey, look, after I had my kids, I lost some volume and I want it just back to where it was. So that's a different kind of request than, hey, I really want something big, So
right.
If you have something in place and you're doing a lift, I find that if you're changing the implants, often you got to go up a little bit because if you're doing a lift, you're taking out some tissue. And if you put the same thing in, you may end up smaller than you want to be. So again, it depends on the individual situation. But that's how we go there with the implants. But those are smooth implants. Some of the things we've heard about, in the literature with issues with breast implants, we can cover that as a special topic if anyone's interested. But those are typically for what they call a textured implant. So these are smooth. The silicone here, it's smooth. It's just there's no texture to it. The other ones are kind of pebbly, where fingers over it, it's got a little little substance to it. And the theory behind that is that it sticks into the tissue, and they thought it would be better. It's not really, but that's the difference. So I use almost always the smooth variety. In rare situations, we might put the textured in, but not very commonly, hardly ever.
Yeah, a lot of patients think, hey, go big or go home when it comes to breast implants, and that's really not the case.
No, if another thing, sometimes people will say as well, my friend is about the same size and they have, some mega size. And then I'll say, did they have one operation or did they have one and then did they do
second round, right?
Pull the second round in, you pre-expand those tissues a little bit, you can go quite bigger. And another case where that actually is important is when we're talking about, it's more of a specialized area, but you talk about the transgender breast augmentation. If you are going from a male to female chest surgery,
right,
the thicker, the breast base is usually wider, so you can usually put a pretty large size in to start. The problem with that is you got to make sure the tissue is going to expand well. So very rarely will anyone want to do any kind of stage procedure. You can do tissue expanders and things that get a little more complicated, but most people do not want that in a cosmetic setting. So what we usually say is let's put the biggest thing in we can do, and we know that if we come back, we could go even bigger and the shape could be even better. So the thing is, for those patients, I usually like to have them treated with hormones for about a year, because that grows the natural breast tissue, because men have breast tissue too, or I should say, genetic males have breast tissue also, and it will respond to exogenous hormones, and then
Mm.
it will grow to a certain extent, and then you can get a better result. It also softens the tissue a little bit, and it gives you a better result with that. So it's they're good procedures. They require a couple little variations in the technique. But
Yeah.
well,